Medical device companies face a lot of pressure to maintain their profit margins. These pressures can be exacerbated when the field force has too much leeway in the amount of discounts and rebates they offer their customers. In some cases, this can be acceptable if there is a strategic initiative in place. However, this should be the exception, not the rule. To better align your financial profitability to your sales performance, there are several methods that can be implemented. Let's review the different methods of sales crediting along with their benefits and shortfalls. There are 3 generally accepted methods for crediting sales to the field force: gross sales, invoice sales, and net sales. Let's break down each method. Crediting at a gross sales level is the easiest method for recording a sale. It's nothing more than list price times the number of units sold. What this method benefits from is simplicity. It falls well short of limiting givebacks. Since there are no repercussions, the field force can offer discounts and/or rebates with no accountability. Crediting at an invoice sales level takes into account any upfront discounts, but does not include back-end rebates. In this instance, the field is somewhat accountable to keep the sale as close to list as possible, but can still focus on post-sale givebacks that won't affect them. Net sales takes into account all givebacks, whether upfront or back-end. Calculating net sales can be challenging because the rebate may not be confirmed for several months. A way around this is to debit the accrued amount from the rebate system against the invoice price. In this instance, the field is completely accountable for the sale. However, this can be complex to administer. In summation, the closer you can align your field force net sales to the financial net sales, the better off the company is as a whole. Regardless of which crediting method is used, there are ways to create financial field force ownership. If crediting on gross sales, you can independently capture and report the giveback amount and have a % of sale threshold on how much is allowed before an IC reduction is instituted. The same holds true for invoice sales, wherein the rebate amounts, accrued or actual, are reported and analyzed against a threshold. For net sales, the threshold should be built in as part of the goal-setting process. To ensure a tightly aligned gross-to-net ratio between finance and field sales, it's important that the medical device companies hold the field force accountable for the amount of givebacks authorized. Rebates and discounts are an important negotiating tool, but should be monitored and guarded to keep the gross to net in harmony. Axtria has amassed years of experience in this area, driving gross to net success for many top pharma companies. Contact us to find out how we can do this for you as well.